Medication is the most important element of controlling blood pressure. Many people may be resistant to a medication, but most people are very willing to monitor their blood pressure at home. When they see the objective readings over time, they are more receptive to starting a medication. And it helps us intensify the regimen and get their blood pressure controlled more quickly. Hi, Ms. Miranda. The process for the self-measured blood pressure program, I would go in and see a patient. If I identified them as having an elevated blood pressure, we would have a discussion about lifestyle modifications to help control blood pressure. I may start them on a medication, and then at our clinic, we have an individual that was trained to enroll patients. Oh, hey, Tyler.
Hey, Kyle.
So I just saw the lady in room 12.
Okay.
I think that she would be an excellent candidate for the blood pressure program.
Great. And she wanted to be enrolled today?
Yes, please.
Perfect. Do you know if she has her phone with her?
She does.
How are you doing today?
Good, thanks.
She would then bring them a device, show them how to use the device effectively, and then sync that device up to their phone.
Download an app on your phone, and that app will store all of your blood pressure measurements. With the SMBP program being so reliant on technology, it was important to have someone in my role being there to be able to troubleshoot any issues that patients faced. And that was during the enrollment process as well as after the enrollment process, just to make sure that technology was not a barrier for them being enrolled in this program. And you want to make sure it's not too snug.
Okay.
So snug enough where you can put 2 fingers in between.
Ms. Williams, we enrolled her, but I'm not getting any of her readings. I was wondering if maybe you could reach out to her and see if she's having issues connecting with the device.
So I can just give her a call and see if we can get her back connected to the program. Hi, this is Tyler calling from the health center. How are you doing today? For this program, the engagement from myself was really important for patients. Constant reminders, constant support saying if you need any help with technology, please reach out to me. I wanted to see how everything was going since you didn't have any readings. It allowed patients to stay engaged with the program and want to continue taking their blood pressure. This program allows them to become a part of their care team. Patients are able to take their blood pressure at home and feel comfortable knowing what their blood pressure is instead of waiting to go to the doctors maybe every 2 months to see what their blood pressure is. And they also know that their provider is seeing it.
So now I could create a follow-up visit with that patient, and we discuss their blood pressure, and I do that in conjunction with all those readings that we've collected. Since you went home and you used the cuff consistently, we were able to get a number of readings that does in fact confirm that your blood pressure is elevated. And it really helps us rapidly adjust those medications. Adding medication is a critical component to controlling blood pressure. And with a traditional model of medicine reliant on the patient to make office appointments at intervals, that's a very difficult model to actually follow. With the SMBP program, with more frequent monitoring and more connection with the patient, the intensification and adding of medication is much more feasible and easier. By scheduling 2 to 3 week follow-ups and continuing to monitor, patients are receptive to adding more medication.
Okay, so are there any side effects with these drugs? I mean, that's like a really huge concern for me.
So normally, side effects are very minimal with medications. Often people they don't want to take a prescription drug. There may be misconceptions about negative effects on the body. I have a discussion regarding the fact that many of these medications have been around for decades. They're well studied. Most people know somebody or have a family member, someone they're directly connected with, who's had an event that could have been triggered by high blood pressure. So they're receptive to trying to get it controlled for themselves.
So would I be able to get off of it?
Most patients usually will remain on it because the lower your blood pressure, the better. So what do you think? How do you feel about trying the medication?
I'm not crazy about it, but I trust you. So I think we can go ahead and give it a try.
My control rates prior to initiating in the program were under 20% across my patient population. After being enrolled in the SMBP program for over a year, my control rates went up well over 60%. It was very reassuring to me. It was just drastic. It's incredible. I can connect with patients and help them lower their blood pressure. And I mean, although they may not realize the gravity of effects of having uncontrolled blood pressure, as a medical provider and someone who reviews the literature, I know the complications can be devastating. And more frequent monitoring of the blood pressure helps us to get it controlled more effectively.